Antisocial personality disorder. Abigail, Winsett, Laura Lundy, and Lila Evans. Part 1. Background. What is antisocial personality disorder? The DSM-5 defines antisocial personality disorder as a failure to conform to social norms concerning lawful behaviors, such as performing acts that are grounds for arrest. Traits of these disorders can be deceitfulness, dishonesty, impulsive decisions, and selfish behaviors. Antisocial personality disorder, signs and causes. Signs and symptoms. There are many signs and symptoms for ASPD, some of these being manipulation, lack of empathy or emotion, and a disregard for other people. Causes and risk factors. Antisocial personality disorder can be caused by genetics or experiences and situations, being neglected or abused, that the person with the disorder has lived through. ASPD is more likely to be found in men and people living in poverty. History of ASPD. The term antisocial personality disorder was first used in 1968 with the second version of the DSM. It gave the condition an identity to separate the addictions or deviant sexuality. This definition was influenced by the research conducted in the 1940s and 1950s at Washington University in St. Louis and Harvard University.
Part 2. Biology. Brain activity. Individuals may have abnormally high serotonin levels, structural abnormalities in areas that process emotional regulation, social cognition, and impulse control. The part of the brain is mainly like the prefrontal cortex brain activity. So there's reduced gray matter volume and cortical thickness, which limits emotional regulation and social cognition in individuals with antisocial personality disorder. The fMRI shows less brain connectivity between regions, and then under-arousal of the autonomic nervous system. Part 3, clinical psychology. Diagnoses. Antisocial personality disorder is diagnosed through mental health exams, which involve the patient discussing their thoughts, behaviors, family history, and symptoms. Typically, people with ASPD do not believe that they need help, so it's kind of hard to diagnose. It's usually only caught when people come out for other reasons, such as depression or anxiety. People with ASPD sometimes do not give an accurate depiction of their symptoms, so testimony from family and friends may be necessary. Treatments and recovery. ASPD is difficult to treat. Psychotherapy in the form of talk therapy can be helpful. There are also no medications approved by the FDA for ASPD, but medications for anxiety or depression may be helpful. The disorder is not really something that can be recovered from.
Part 4. Additional information. Famous people with ASPD. Many serial killers suffered from ASPD. Some examples are Ted Bundy, Charles Manson, John Wayne Gacy, Eileen Wuornos, and Rodney Alcala. 5 statistics. ASPD affects 0.6% to 3.6% of individuals. It affects 50% to 80% of incarcerated individuals. Nearly 80% of individuals with ASPD had their first symptom by age 11. 25% of girls who showed antisocial behavior as children have ASPD. For boys, this number is 40%. Important psychologists include Lee Robbins, whose research influenced the definition of ASPD in the DSM, Robert Hare, who created the psychopathy test, and Hervey Cleckley, who wrote a book defining psychopathy. Thank you.